DR is asking, sir, what is the top score of this paper? Definitely not more than 230. Because every 100 में 22 means ultimately 70 illogical निकलेगा. Definitely not more than 230. Right? So 22% or 25% are illogical. 25% common sense, 50% is crackable by everybody. That means 300 में 150 मिल जाएगा. Right? Remaining 25% में maximum out of the remaining 50% में we can say around 15-20% marks will add. So that way the score will be somewhere around 200-210. Out of that means 70% score is a good score in this paper. Let us see how you cracked it. HHV is HHV 8 is Kaposi. At least he didn't even ask HHV 3, 2, 4, 5, 6. Varicella zoster virus is HHV 3. Last time they asked. Pheochromocytoma, lumpy bumpy neuroma, morphinoid habitus type 2B. Basket wave pattern is typically Alport syndrome. Thinning of the basement membrane leading to basket normal GBM, abnormal GBM and Alport may abnormally split GBM with the lamination. Looks like a basket weave pattern. Which Hodgkin's may read Steinberg will typically of the lacunar type, nodular sclerosis may. So this is a lacunar cell which you see in nodular sclerosis. GIT polyp pigmentation is a Peutz-Jeghers, even MBBS first year student knows this. Illogical. We hate to see such questions. Synovial sarcoma में chromosome number. Why doctor? Brilliant doctors are prevented from entering MD and stopped at MBBS level. ऐसे questions के वजह से. If you are truly brilliant, you will still get seat in spite of such questions. Because you answered the standard questions correctly. One more illogical. pH of Savarad dextrose agar, pH of Diet Pepsi, Diet Coke, pH of Sprint, Vodka, who will know? 5.4. Which hepatitis is by drinking water other than hepatitis A? Typically hepatitis E. To know the efficiency of a disinfectant, we all know Riedel-Walker coefficient. उसका जरा next level का होता है Chick-Martin test. Illogical. So Chick-Martin is a modification of Riedel-Walker method to know the presence of organic matter. Then Ijkman test is to know the coliform organisms. Probably tomorrow's exam they may ask this Ijkman. Rose Bengal test is for the knowing the efficiency of pasteurization of the milk. That is Riedel-Walker. That R and this R you are confused. No, Rose Bengal disinfection के लिए भी है. But anyway, Chick-Martin is Chickney answer, we are sure, right? So we'll check the Rose Bengal also. Enrichment media for transport of cholera क्या होता है? Alkaline peptone water. Yeah. Siddiqui is asking, sir, Anton test is also for disinfection, is it? So many Britishers, Frenchmen, Italians, who remembers? Riedel-Walker is known. This Chick-Martin known. Illogical में डाले ना? हाँ? भूलना मत. Antibiotic colitis is Clostridium difficile. Anaphylactic reactions are all IgE. MAT test is used for leptospirosis. Illogical. Dalo. Fatal dose of arsenic. Actually, this is an old question, but you should fatally remember it. Kind of a thing. 100 to 200 mg, right? Still I call illogical. You didn't read this also, still you will get seat. Illogical का मतलब वो होता है. One question definitely will be asked on IPC sections. वो list ले लो, 10 to 12 common sections. So you should never disclose the name of the rape victim under Nirbhaya Act. If you do that, you will be thrown into jail. 220A, 222A, na? 8. Answer should be A, you mean to say. Oh, I didn't check that. I thought examiner's key, no. Mostly it may be right, bolke. I think there is a key correction. Correct. Saras and Dolly and Suryaprabha, Sai Krishna, everyone is saying A. Agreed. A is the correct answer. What is regression? To know the value of one variable based on the other variable is basically called regression analysis. So you have a simple linear regression or you have got a multiple variate regression. Simple linear regression में एक independent and एक dependent variable होता, right? मोटे जनों के बदन में high value of lipid is there. So being mota versus having a high lipid, one variable is dependent on the other. Only two variables are deciding, right? मोटे होके स्मोकिंग करके पान भी खाके sedentary lifestyle रखे, 4-5 factors you are comparing towards one lipid value, then that become multi. So that is regression. Mission Indradhanush. So अभी गवर्नमेंट के प्रोग्राम्स के लाइन पे आगे डॉक्टर इलॉजिकल में डाल दो. Unless you are regularly reading newspapers and पार्क में नहीं आएगा. नेक्स्ट गवर्नमेंट आने के बाद इस गवर्नमेंट का स्कीम्स आएगा पार्क में. सो वी यूज अ कैचअप स्ट्रेटेजी. So catch-up campaign program is Mission Indradhanush. At least this may repeat in tomorrow's exam. Remember, diphtheria, whooping cough, tetanus, polio, TB, measles, hepatitis B. They are the conditions which are specifically targeted under Mission Indradhanush started by the Health Ministry, and full immunization coverage, which is currently at 65%, to be expanded to at least 90% of the children in the country is the ambition. Beautiful question, doctor. This will, once more similar question will come. Those who answered will score better. 6-year-old कभी भी वैक्सीनेशन नहीं हुआ. अगर कभी भी नहीं हुए तो 3 doses of DPT दे देना, 1 month apart, and a booster dose after 6 months of the last dose, and a single dose of JE vaccine, because it is an endemic area of Japanese encephalitis. As per IMNCI, what is the preventive measure taken during the referral for dehydration of the babies? Prevention of low blood glucose. Helpage India supports income generation. There are 100 million elders. 100 million बोले तो 10 lakh. 100 million बोले तो 10 million is 1 crore. 100 million is 10 crores. 120 crore populated India में 10 crore helpless elders हैं. 55 million of them are sleep hungry. Without food they go to sleep, waiting for tomorrow's early morning to come so that they can have food. That is the situation, doctor. So, do you think that our lives are little better? We are only preparing for entrance. 30 million live alone. Yeah, that is very challenging task. Aajkal one child norm, and that child ultimately will be going to America. और उनके मामा जी के घर में रह जाते, he won't come back. So wife dies, and old age is very dark to live. So, and India mein people really don't do mistake of marrying 2-3 times. One mistake they will realize that enough is enough. 12 million are blind, cannot afford treatment. 90 million need to work to eat. If you look at auto drivers or somebody, very old people will be still working. Some will work due to self-respect. Who will depend on my son? They will say. Still they have that high self-respect. That's good. Isliye, all our ambition should be to create employment opportunities is what the government started. 3,200 elderly self-help groups covering more than 42,000 elders operate across India. That means 10 crore helpless elders hai to at least 42,000 elders we are able to help, at least to begin with. International health regulation mandates all types of mosquitoes for a distance of 400 meters. You answered only Aedes? एक बार review करो doctor. I am not sure about this Kerala PG answer. Just review that. Which is obstructive lung disease? Byssinosis is obstructive. Whereas silicosis, anthracosis, hypersensitivity pneumonitis of the farmer's lung, they are all come under the restrictive with a fibrotic element. In case of byssinosis, there is a bronchospasm, so it falls into obstructive. Wealth index is an economic index used by whom? National Family Health Survey 3. Common sense question actually. Common sense bole to I don't know how to classify it as. But National Family Health Survey, Census of India, most recent Census of India, जरा एक बार देखना. Sex ratio कहाँ ज़्यादा है, कम है, all those demographic. So wealth index is calculated. How you know how is wealth index is calculated? घर में कितने टीवी हैं, साइकिल्स हैं, फ्रिज है, फ्लिपकार्ट का पैकेट्स है, वो सब देख के आपको मालूम पड़ जाएगा कि ये कितने वेल्दी है. That is the way to calculate wealth index. If you do ozonization of water, oh my God, chlorination we know the value, ozonization का भी value रहता. A residual value of 0.5 milligram per liter after contact of 20 minutes. Contact of? So यहाँ 20 minutes. That's what. उतना standard question है क्या? सबको मालूम है? अभी मालूम हुआ ना? Illogical में डाल दो. Transmit viral encephalitis, heart tick is the one. So Rocky Mountain spotted fever, tularemia, tick typhus, Colorado fever, KFD. You should get like a hiccuping, like hiccups. All these things must be there in tips. Exam hall mein, if you are thinking, you won't. Illogical. नॉर्थ कोरिया का प्राइम मिनिस्टर कौन है? साउथ कोरिया आजकल क्या कर रहे हैं? पाकिस्तान हम हमारे साथ क्रिकेट खेल रहे हैं या नहीं खेल रहे? नवाज शरीफ क्या बोला? So all this for entrance exam is too heavy. Yeah. Southeast Asian area of WHO में South Korea is not participating because North Korea participated. That is the only reason. Then all medical and nursing personnel in contact with plague should receive oral tetracycline. If all the values of a group of data are multiplied by 10, what will happen to the resultant standard deviation? So you must know the standard deviation formula. Every value minus the mean value whole square divided by the total number of values is standard deviation. एक example ले लो 4-5 values and try करो exam hall में. Then you will get the answer as standard deviation also get multiplier by 10. Okay? इसके लिए थोड़ा high level mathematics, actuarial mathematics होना. Safe field of water is defined as water that is adequate for 95% of year. Illogical में डाल दो. कितना लीटर्स का जरूरत है वो मालूम है, प्रॉब्लम विलेज डेफिनेशन वो भी मालूम है. सडनली से फील्ड बोले तो हाउ मच यील्ड, कितना पानी निकले तो कुएं से, कुएं या कवे, कुआ ओनली नो, कुएं से आप कुएं के वाटर लेवल के हिसाब से आपका एमडी का लेवल डिसाइड हो जाएगा, तो दिस इज हाइट्स डॉक्टर. व्हाट इज एग्जामिनर एक्सपेक्टिंग? सीट नहीं मिले तो हम तापी मेस्त्री बन जाएंगे, कम से कम बाथरूम क्लीन करने का काम या कारपेंट्री वर्क, क्या है डॉक्टर? 50 फीट होना है सैनिटरी वेल, डिग करे तो 40 फीट 40 फीट. मैंने बोला ना, सेप्टिक लैट्रिन is a favorite question. Different types of latrines and what is the difference between village गए तो कैसे लैट्रिन का स्थापना करते आप, रिबन कटिंग किस टाइप ऑफ लैट्रिन, इफ यू गो इनटू a forest, Adilabad, the tribal area, you should read passionately SPM. C is the correct answer. But anyway, एक बार चेक करो, वो भी चेक करो. मैंने I could not stoop down to that much a low level. So, ये तो स्टैंडर्ड क्वेश्चन है. करतार सिंह ने मल्टीपर्पज हेल्थ वर्कर्स को बुलाए. सो बोर क्या किया, मुदलियार क्या किया, श्रीवास्तव क्या किया, ऑल दिस कमिटीज. फ्लोरोसिस क्यों आएगा? जॉवर खाने से. व्हाट इज पॉइंट 9 ऑफ 20 पॉइंट प्रोग्राम? आजकल तो 25 पॉइंट प्रोग्राम आ गया नरेंद्र मोदी के सरकार में. सो 25 ही पढ़ो, बट पॉइंट 9 क्या है? अटैक ऑफ रूरल पॉवर्टी. इंदिरा गांधी जी के जमाने से गरीबी हटाओ इज देयर. स्ट्रेटेजी फॉर रेन एग्रीकल्चर इज 2, इरिगेशन वाटर इज 3, क्लीन ड्रिंकिंग वाटर इज 7, हेल्थ फॉर ऑल इज 8, 2 चाइल्ड नॉट इज 9. लाइक दैट 20 पॉइंट्स. वेयर विल रिमेंबर ऑल 20 डॉक्टर? अभी 25 हो गया, वो छोड़ो, इलॉजिकल में डाल दो. आप तो थोड़ा जंगबाजी, मैसूर के टिप्पू सुल्तान ने क्या किया, उसका तलवार कितना लेंथ है, वो सब पढ़ना है एमडी सीट के लिए. सो बैटल ऑफ सल्फर, व्हाट इज इट? सॉल्फरिनो. बैटल ऑफ सॉल्फरिनो was in 1859, leading to victory of French army. Don't start reading American history. Under Napoleon III and the Sardinian army under Emmanuel II. Right, doctor? And you should remember, right now, this is which battle you are fighting in the entrance exam. PGA is PGA का जंग, उसके बाद एम्स का जंग. अभी कौन सा जंग आप जंग के मैदान में हैं? Actually, after this war, so many got killed that they then thought too much here. अगर इंडिया को देखे तो without much battles they will play playing cards and decide Dharmaraja will give all his this thing and go to forest. Indians are very simple method रहता how to conquer the enemy. एक खेलबाजी करके करना, ये मार के पीट के खून बहा के, तो then they brought Red Cross into this thing, right? Then what is wrong about leptospira? Yellow fever. Yellow fever is heat sensitive. It is 17D, subcutaneously given. All these are very well known facts about vaccines. Actually, suberosis should be there, not siderosis. Siderosis is iron. Suberosis is cork dust. So, sorry for that spelling mistake in the paper. Anthracosis, coal dust, silicosis, silica, siderosis, iron, bagasosis, cane bag, sugar cane bag, bicinnosis, cotton, former is hay dust. मैंने बोला ना ABPA जरूर पूछेगा. So allergic sensitization to aspergillus fungi is ABPA. Kaplan syndrome is rheumatoid arthritis plus pneumoconiosis. Signet ring cell is typically seen in bronchiectasis. Cystic fibrosis is autosomal recessive. In COPD, it is not fully reversible. If it is reversible, you call it as asthma. Why will you call COPD? So asthma is also a COPD. So reactivated TB produces diffuse bronchiectasis. Eggshell calcification is silicosis. Crazy paving sign actually is alveolar proteinosis. In addition to that, even silicosis also will produce a pattern similar to that of that crazing paving. Loeffler syndrome ascariasis की वजह से. You answered filariasis, है ना? I know. When we do a government job, we get different common answers when we go for entrance exam. So, excellent inheritance mein, what is the chance of having a baby with a condition if the female is a carrier? Let us see. Mom is carrier, dad does not have it. Then what will happen? The boy will not have this condition because boy is due to the what? Boy will not have this condition if he got the normal X. One boy will have it because he got the abnormal X, right? And like that. So 25% chances are there. ABO transfusion reaction is, doctor, this is illogical medaldo. Sorry, this is hypersensitivity they are asking. That's what, it's a hypersensitivity based question, no, type 2. Immune complex deposition is type 3. Fixed antigen like RBC membrane, antibody attacking it like a anti-B, anti-A is basically type 2. Easy question. A illogical mat dalo. दूसरा और एक क्वेश्चन है illogical. Vitamin E, sunflower oil, ये तो common sense. What is your answer? Liver? I didn't check this. So anyway, the answer of the Kerala board is sunflower kind of thing. Oh, a common sense wala question. It doesn't not very sure, not completely out of the game. पोटेशियम कहां से मिलेगा? ड्राई फ्रूट खाने से. इन्फ्लुएंजा ए के लिए oseltamivir is the one which is used. Fetal skull largest diameter is submentovertical, which is typically if it is there, then only you have to do by cesarean. For a well controlled diabetes, 2-hour postprandial in pregnancy क्या होता है? In pregnancy is different from that of non-pregnancy. For a non-pregnant woman up to 120 fasting माफ किया जाए, मगर pregnant women में strictly it should be less than 100 fasting. So 2 hours postprandial is less than 120, 1 hour postprandial is 140 are the recommended glucose goals. Early deceleration is head compression. Antiprogesterone can be given up to 63 days. When do you want to conservatively manage an ectopic pregnancy without surgery? 5000 IU and size of mass is less than 4 centimeters is the typical criteria. Partial mole versus complete mole. Now what is the important carry home message you get here is, gynecology option is 30 questions aate na? We got an excellent teacher, Dr. Shilpa, who teaches super duper obstetrics gynecology. Illogical questions can never come in gynecology obstetrics. क्यों? क्यों बोले तो it's a very predictable pregnancy, right? I'm not talking about gynecological psychiatry. I'm talking about that is most unpredictable. But predictable thing is gynecology obstetrics. इसलिए गाइनॉक्स में जो 30 out of 30 मार के आएगा, he is Bahubali. So be sure. So karyotype of partial mole is 16 XXX. Complete mole is 46 XX or X5. So all these differences clearly you must religiously mug it, doctor. Fetal blood loss occurs in vasa previa. Then placenta ecreta with a deep indentation. When will it occur? If there is any previous previa. During PPH, where will you ligate? Anterior division. This is common sense question. पढ़ने से नहीं मिलेगा. Lot of people will know up to interiliac artery ligation is done. Now he is asking which part of the interiliac. That means uterine artery is arising from where? Anterior or posterior? So common sense question. Renal agenesis is supposed to be oligohydramnios. Magnesium toxicity में DTR depression is the first feature. The most common cause of the rupture होता है previous uterine surgery. Fetal hemorrhage is basically complication that occur by abruptio, intrauterine fetal death or ECV, not by bleeding disorder in pregnant mother. Which drug? Here the question asks feto-maternal, from mother to fetus, not mother bleeding. Mother bleeding होता है if there is a bleeding disorder in the mother. The drug that inhibits, which is a toccolytic, but can lead to pulmonary edema, is which one? Ritodrin. Post-term labor, where do we see? Anencephaly में. Phase 2 pubes, osseoid posterior you will get, that is otherwise called osseoid-sacral. Then Bandel's ring is whenever cephalopelvic disproportion is there. This beautiful question. Cephalohematoma versus caput succedaneum versus subgaleal hemorrhage. At the point of the contact, whenever the bleed occur and it extend across the suture, that is caput succedaneum. But if it is usually occurring in the parietal bone prominence and it does not cross sutures, hota hai cephalohematoma. Hematoma is limited by the sutural lines. I leave the literature for you, which will reach maximum size when blah blah blah. Does not cross suture line is the nature of? Oh, cephalohematoma, which is correct only he asked, no? Where is maximum size and firmness at birth is caput and increases after birth and resolution over 2 to 3 weeks. Resolves within 1 to 2 months is, I think examiner forgot increases after birth, but maximal size at birth is the feature of caput succedaneum. So presented birth is wrong thing about cephalohematoma. Huh? Correct diya na? I think except bol gaya. See doctor, when is the timing of resolution? 48 to 72 hours is caput succedaneum. And resolution over 2 to 3 weeks is the nature of cephalohematoma. So resolves within 1 month is almost 2 to 3 weeks, means 4 weeks means jara nazdik hai na. So this is a true statement. Fluctuation do we see? Huh? Hematoma doesn't fluctuate, but succedaneum should fluctuate, right? Because of the edema. I think there are two wrong. In this, the correct statements are option A and option D. Agreed or disagreed? B and C are wrong statements. So examiner gave, didn't ask what is wrong. If he would have asked what is wrong, B and C would have been. Then his C would have been right. So a little ill-framed question. छोड़ दो, सबको right दिया जाएगा. But don't expect. Don't go and have a dream. All the wrong questions of me are discovered to be misprints. So that's the reason वो सब माफ हो गया, मुझे seat मिल गया. I mean, it's a positive dream. So worst prognosis in pregnant women is Incus syndrome. Which antimalarial you can't give in pregnancy? Primaquine. pH of the vagina, this way will know easily. Amniotic fluid का pH बोले तो last time Maharashtra state entrance में पूछा. That is impossible question. Last time you remember what is the amniotic fluid pH was the question. Acidic pH na 5.5, 4.5 non-pregnant versus pregnant कुछ फर्क है ना? This is only slightly acidic. How can it be 4.5? थोड़ा ज़्यादा acidic है ना? I don't know. I mean, we will check that. We will check that. Maybe our online students can help us to get a quick reference on the vaginal pH. Then side effect of clomiphene citrate क्या होता? Multiple pregnancy should be the answer, but that is not called side effect. That is 1 plus 1 Dashara offer. But teratogenic effects are not this also a little cracky question. Increased risk of ovarian cancer, will it lead to excess ovulation? Ovulation means it will open up. Oh, this also is little dually answered question. जरा ये भी wrong frame में डाल दो. Mayer Rokitansky Kastner Hostner में क्या होता? Uterus will be absent but ovaries and fallopians are present. What is the most sensitive method to detect the cervical chlamydial infection? Polymerase chain reaction is the fastest way. Chasser-Moyer technique. This is a very old question. Vesicovaginal fistula may we basically widely separate the vagina and the bladder by a flap splitting method which is called Chasser-Moyer. Birth trauma is a risk factor for prolapse of uterus. Most prolapses of uterus are obstetrical underlying cause. Asherman syndrome will be more common if you do DNC to manage a postpartum hemorrhage. There is a greater chance of forming future endometrial adhesions. Emergency contraception, it won't stop early pregnancy. It won't interrupt the already established early pregnancy. It will only prevent pregnancy from happening by preventing the implantation, inhibiting fertilization and ovulation, etc. etc. Huh? Yeah, delaying and inhibiting the ovulation. Huh? It won't affect ovulation. You are taking, what is emergency contraception? You are taking double dose of OCP. OCP ultimately affects the ovulation, right? So the same thing it will also do. May not be the main mechanism, but it will also do. But already pregnancy established हो गई तो वो कुछ भी नहीं कर सकते. इसलिए you have to use it within 72 hours before the pregnancy get established. So there is a difference between interceptive versus contraceptive. For a newly married woman, rheumatic heart disease, husband should use condoms is the safest thing. Progesterone only pill is for lactational mother, it will help. Fibroid, it is not usually malignant. It is also not usually, it is usually asymptomatic, but for the menorrhagia, right? So, I think A should be a more appropriate answer. Change in the key. What site endometriosis you won't treat with medical therapy? So, I am not very sure about chocolate ovarian cyst is there, so surgery need to be done because hemorrhagic lesions are there. Okay. Then premenstrual syndrome, always fluoxetine, sertraline, SSRIs. Metropathia hemorrhagica is due to the unopposed action of the estrogen. So oppose it by giving progestogen. Illogical. Illogical भी नहीं है, ये तो standard question है actually. Everybody bite to bite they will read it. 28%. Therapeutic conization. Actually there are dual answers. We use it in CIN 3 and CIN 2. So B is more appropriate answer. Diagnostic indication is option C, unsatisfactory colposcopy. Then once more state MD entrance may they are going to ask you loop electrosurgical excision procedure devices and ask where will you use them. Huh? Don't say to catch fishes. It's not a fishing rod. Most common cause of death in carcinoma cervix is uremia because carcinoma cervix involves parametrium compressing the ureter leading to obstructive uropathy and uremia. Pure germ cell tumor is basically dysgerminoma. CA125 is epithelial cell carcinoma of ovary. Sonosalpingography is for tubal patency. And when will a normal child speak the first real word? 12 months, 1 year. So when do you call diurnal, when do you call nocturnal enuresis? Diurnal means wetting while both day and night. So accordingly there are different ages up to 5 years. When do you call abnormal enuresis? Beyond 5 years if somebody is continuing to have enuresis problem. Major depression may you find all these things, feeling of worthlessness, insomnia, markedly diminished interest in activities, etc. Autistic disorder may persistent preoccupation, stereotyped, emotional reciprocity, etc. So now, did you understand? One subject questions, rulate, we feel like crying. Some subject questions are like all of the above, all of the above, all of the above. Some questions are logically framed. Why all this happen in an entrance exam? Because one single guy won't set paper like Murali Bharadwaj. So there is a reason, there is a large amount of non-uniformity. Right? So that is the reason, suddenly when you start a particular subject is very tough to crack, you may get a feeling that entire paper is like that, but that is not true. Only pray God. Doctor, pray God. What will you tell? Oh my God. At least medicine, surgery, gynocs, reasonable people, let them set the paper. All other, however illogical guys set the paper, I don't care. Suppose tough anatomy questions, 5 questions aaya. Maximum 5 each hota. No tension. ENT, 10 questions. Maximum toughness will be there for the next 10 only. Medicine tough गए आके बैठ गए, वो तो ECGs मार रहे हैं, वो भी anterior fascicular block को discover करने के लिए बोल रहे हैं, आप discover किया. But then he is asking, what are the, which are all the following are the causes of this above ECG except, who will remember anterior fascicular block के specific causes? So such questions आए, epidemic proportion में आ जाएगा. At a time. These are all psychiatric guy completely gave all of the above only, all of the above, or otherwise easiest answer possible. Dyslexia. Dyslexia means the very word says difficulty in reading. Finish. First line only देखे आप answer ये मार के आगे बढ़ सकते. What is, I mean those who are still suffering dyslexia continue to read all the remaining 3 options. Okay. Then what is palliative care? Palliative care is when the life is threatening and you can't help it, that is called palliative. Finish? All the correct answers are located in the option A only. So examiner even don't want you to take effort in going all the way down. Complementary feeding is timely introduction of foods other than the breast milk or formula. What is supplementary, what is complementary, same or different? Time introduction of foods other than the breast milk or formula. Hypernatremia is less than 135. Antidote of acetaminophen is basically N-acetylcysteine. And for a school going child, what is the non-pharmacological treatment of therapy? Hypnotherapy. Your maths teacher is very good. Your classmate girls are still liking you, don't feel painful to meet them. So if you train kare to, the boy will get some courage to go to school. So hypnotherapy. So the various areas of the brain which transmit the pain, they all get modulated with the hypnotherapy.